Graves' disease. Graves' disease is an autoimmune disorder that results in overproduction of thyroid hormones or hyperthyroidism. The thyroid is a small butterfly-shaped gland in front of your neck. Thyroid hormones control the way your body uses energy, so they affect nearly every organ in your body. Graves' disease is caused by the combination of genes and an outside trigger such as a virus. Your own immune system attacks the thyroid gland by releasing an antibody called thyroid-stimulating immunoglobulin or TSI that attaches to the thyroid cells. TSI acts like a thyroid-stimulating hormone, a hormone made in your pituitary gland that tells your thyroid how much thyroid hormone to make. TSI causes your thyroid to make too much thyroid hormone. Women, people older than age of 30, having other autoimmune disorder or having a family history of Graves' disease are more likely to have Graves' disease. Common signs and symptoms of Graves' disease include anxiety and irritability, a fine tremor of hands or fingers, heat sensitivity and increase in perspiration or warm, moist skin, weight loss despite normal eating habits, enlargement of thyroid gland or goiter, change in menstrual cycles, erectile dysfunction or reduced libido, frequent bowel movements, bulging eyes or Graves' ophthalmopathy, fatigue, thick red skin usually on the shins or tops of the feet or Graves' dermopathy, rapid or irregular heartbeat or palpitations, sleep disturbance. About 30% of people with Graves' disease show some signs and symptoms of Graves' ophthalmopathy. Signs and symptoms may include bulging eyes, gritty sensation in the eyes, pressure or pain in the eyes, puffy or retracted eyelids, reddened or inflamed eyes, light sensitivity, double vision, vision loss, double vision. If left untreated, Graves' disease can cause serious complications, including a rapid and irregular heartbeat that can lead to blood clots, stroke, heart failure, and other heart-related problems, thinning bones, osteoporosis, and muscle problems, problems with menstrual cycle, fertility, and pregnancy, eye discomfort, and changes in vision. Graves' disease is a lifelong condition. However, treatments can keep the thyroid gland in check. Medical care may even make the disease temporarily go away. Graves' disease is a lifelong condition. However, treatments can keep the thyroid gland in check. Medical care may even make the disease temporarily go away. Beta blockers, such as propranolol and metoprolol, are often the first line of statement. Graves' disease is a lifelong condition. However, treatments can keep the thyroid glands in check. Medical care may even make the disease temporarily go away. This includes beta blockers, such as propranolol and metoprolol, are often the first line of treatment. These medications regulate your heart rate and protect your heart until other hyperthyroidism treatments take effect. Anti-thyroid medications, such as methimazole and propylthiouracil, block the gland's production of thyroid hormone. In a small percentage of people, there is a risk in taking these medications. It causes skin rashes and low white blood cell count, which may increase your chances of infection. Rarely, liver disease develops. Radioiodine therapy involves taking one dose of radioactive iodine in pill or liquid form. Over 2 to 3 months, radiation slowly destroys thyroid gland cells. As the thyroid gland shrinks, hormone levels return to normal. Women who are pregnant or breastfeeding shouldn't get this treatment. Thyroidectomy involves surgically removing all or part of the thyroid gland. After surgery, some people produce too little thyroid hormone, so they may need to take thyroid replacement hormone medications. Sources for this study about Graves' disease can be found at niddk.nih.gov, mayoclinic.org, my.levelandclinic.org. Motor neuron disease, or MND, is a name for a group of diseases that affects particular nerves known as motor neurons. In MND, those neurons generate and die, and slowly the muscles become weaker. This leads to paralysis. The exact cause of MND is not known. Generally, MND is believed to be caused by a combination of environmental, lifestyle, and genetic factors. Most cases of MND occur spontaneously without any identifiable cause. Around 1 in 10 cases are hereditary due to a genetic mutation or error in the gene. People who inherit the genetic mutation have a high chance of developing MND, but not all people with genetic mutation will develop MND. MND is a progressive disease that usually starts slow and gets worse over time. Symptoms sometimes start on one side of the body and then spread. Usually, the first things people notice are weakness in the hands and grip, slurred speech, weakness in the legs, and a tendency to trip. Weakness of the shoulder, making lifting difficult, cramps and muscle twitching. Later on, people with MND have little or no movement, have trouble talking, breathing, and swallowing. A few people with MND develop a type of dementia. If you have MND, your senses won't be affected. How is MND treated? There is no cure, but a lot can be done to ease your symptoms. Maintain quality of life and keep yourself mobile as long as possible. Medication, supportive devices, and physical therapy can help. Most people with MND die within 2 to 3 years of developing the condition. However, some people can live a long time. The sources for my study of MND can be found at medicalnewstoday.com, healthdirect.gov.au,